Good evening, all. Welcome to another session of Mental Health First Aid India, Beyond Addiction, Understanding Substance Use Disorder as a Mental Health Condition. I will set the tone by giving some statistics and facts around it, and then we'll continue with conversation with my esteemed guest. Now, let's start with some data. It's quite revealing to see the prevalence of mental health problem like substance use disorder in our country, and it really deserves an attention. So data from international forums like WHO and Government of India says that India has approximately 267 million adults who are tobacco users, and the age is 15 and above. There are a minimum of 16 crore people from age 10 to 70 who are alcohol users. Further, among the illicit drugs, there are 3.1 crore who are cannabis users and 2.26 crore who are opioid users. Wow. Lots of data. Now, another fact is that smoking-related mortality remains significant health concerns in our country, with 10,48,266 deaths, which are recorded in 2021. Here we have another data which actually will be quite concerning, especially for parents. Inhalants, with an overall prevalence of 77 lakh people using it. Among them, the majority is children and adolescents. 51 lakh children and adolescents in our country actively use inhalers as compared to 26 lakhs adults. So it's a matter that we really need to concern as a problem that we need to discuss. We need to talk openly about it. We need to understand and then take action on how we address it. So what is substance use disorder by definition? So we definitely navigated among the DSM-5 and the ICD-10, who are the guiding books for the naming or diagnosing someone after a mental illness. So substance use disorder is a mental health condition. I'd like to repeat it. And that's not for because I'd like to repeat, but it is because I'd like everyone to hear it well, that substance use disorder is a mental health condition involving the recurrent use of alcohol or drugs that causes significant clinical and functional impairment. Why I said that I wanted to repeat this. With my experience, whatever lifelong in my country, Albania, or here in India, wherever I've been, substance use disorder are always misunderstood. And even today, wherever we go and deliver training, mental health first aid training, there is a poor understanding that substance use disorder are actually a mental illness. Most of communities look at it as okay, of course it's a maladaptation, but as a choice, as a behavior that people can choose to change, to deal with that. It's a level of being irresponsible and so on and on. So I'm not bringing here the names. We'll definitely talk further in detail about the clinical perspective of it, but we need to all remember that this is a mental health condition, and the mental health condition is an illness, just like any other physical illness, and therefore we need to look through those lenses. So to bring a bit more of it, I'd like as well to humbly request, and we will see further down how this is actually the reality, that to the numbers that I gave earlier, that are struggling with substance use disorder, at least minimum add one more person who are directly impacted, who are the carers, who are people that are near them, living with them, and in a way or in another are impacted by it. So I think by now we understand the depth of this problem, the impact, which we will elaborate a bit more further, but just the numbers tells us a lot. So among all these numbers that we said above, 44% of people using drugs trying to give up drug use, the substance, and only 25% of these 44 received treatment. As we have said as well early in other live talks where prevalence of mental illness is high, substance use disorder is the highest, 22 in overall percent life prevalence. The gap of treatment remains very, very, very high. There is a huge amount of people under substance use disorder that goes untreated. This is when people realize that they need treatment. And we have a number of people, a huge number of people who consider this that it's just a habit, just I'm passing time, just I'm not hurting anyone, who yet are yet to realize that this is a concern, this is a illness that need to be addressed. So let me just, there are a lot of action by the government of India, but I would not mention them right now. I'd leave them to my guests to bring those services and what are the activities or initiatives under it. But immediately, without losing time, I would welcome my esteemed guests. I have three today. I am so, so happy to have here John, and I would like to highlight here that name is changed, who is a person who has lived experience with alcohol. I have Eva, who is the spouse of John, and gracefully she has accepted to come here and share with us the experience. And of course, I have a very good professional, Soumya Shankar Raman, who is Chief Operating Officer at TTK Hospital, Chennai. So I'd like to welcome all of you, and thank you so much for accepting to be here, accepting to talk a topic which is so common, so prevalent. I can't call you how large this elephant is, but it's not invisible, it's so visible, just that we do not address it. So thank you so much and welcome to Mental Health First Aid India conversation. Allow me to start with you, John. Okay, I know you are here with us. We do respect that you are choosing to keep yourself anonymous, and it's absolutely fine with that. We would definitely have a kind request to, and because I'm sure many people that will be listening and hearing this session will definitely listen from their point of view, but will relate a lot. And we would absolutely love to hear from you. I'll make the question in three blocks because I would not like to stop in between and make detailed question. I would maybe say that I'll be grateful for you to share with us and our audience your experience before. How was life before using substance, using alcohol? How did it started and struggles, changes, impact, effect, behavior, your own emotion and mental health? What changed your work? What changed with that? What were those phases that suddenly you realized it was no longer in your hand? And of course, the most important part that people uh, experience and wants the most of the strength and support is the rehabilitation stage, which you have recovered so good. And congratulations to that. And of course, people will be keen to hear about it. So to you, John, with your story, for all of us for everybody that is hearing.
Thank you, Erinda. Thank you for having me here and for giving me this opportunity to share my story. Um, so let me start off with addressing the first part of your question on how it all started. I think this is a story or a situation which many people will relate to because it started off in the most casual of ways.
Mhm.
Um, Probably, I think it was sometime during early undergraduation
Mhm.
days in college, where
Mhm.
it is sort of the in thing or the macho thing, right? To
Yeah.
start taking to grab a bottle of beer with
Mhm.
friends. It started off with that, very
Mhm.
casual, very social, and as has been glorified in many movies, it was like who could consume more. and who could walk around and drive around also after
Mhm.
consuming. So it was all fun, stupid, uninformed fun when you think about it later. But
Mhm.
it started off as that.
I see.
Then gradually progressed where, yeah, it was fun for many years, I would say, and
Mhm.
gradually progressed where it started taking control of everyday life kind of thing. So
Mhm.
I started associating it with other activities or happenings in my life. Like if
Mhm.
something went wrong, I would fall upon alcohol as a crutch. If something went well, that was a reason to celebrate. So it became a part of life, so to say, and
Mhm.
that's how the progression towards becoming an alcoholic was in progress.
Mhm.
And uh, I think a few years later, it reached a stage where I felt the compulsion to consume on a daily basis.
Oh. Mhm.
So I could consume. I continued working. Have been lucky or blessed enough to be a good performer at work, but
Mhm.
we could clearly see that there were impacts like flashes of anger,
Mhm.
irrational behavior.
Mhm.
Uh, Started, and of course the main thing was it had started affecting family life with my partner Eva, who's been with me through thick and thin. It had started affecting family life, frequent arguments on multiple things, right from not enough time spent to trying to mask that I've consumed,
Mhm.
to trying to make out instances to go out and consume. You name
Mhm.
it, done it kind of thing. So it had reached that stage.
Mhm.
And post that, yeah, this again was a phase for many years. And
I-
it all reached a head at some point where, yeah, it was recognized by everyone around that something had to be done. And
Mhm.
again, I was the last person to acknowledge that because I always felt I was in control and I could stop when I wanted. And
Mhm.
there were instances where I could stop. That was actually the best part. I
Okay.
could stop and be in control of myself for many months together, but then again I would slip into it,
Yeah, relapsing
right?
it. Mhm.
Relapsing happened. So
Mhm.
then finally reached a stage where it was either get help or lose everything forever kind of
Mhm.
situation, family wise, society wise, work
Mhm.
wise, all of it.
Mhm.
That's when I made the decision to seek help
Mhm.
by myself. This was suggested many times, but that switch had to come from within myself, and that happened.
I see.
And once that happened, life changed. So I had Eva's support, I had my family's support, and I
Mhm.
had support from a very unexpected quarter, which was my workplace.
Mhm.
Uh, so my immediate boss backed
Mhm.
this particular effort to come clean, and very thankful for that. So
Mhm.
then the journey started in earnest, where yeah, I submitted fully to the treatment and the counseling.
Mhm.
Uh, it's now 4 years and counting, and I hope long may it continue.
Awesome. Congratulations on that. Thank you so much, John. I just want to go a bit more in depth if I mean, whenever you feel comfortable, you can share as much as you feel comfortable. But I'd like to give a more experiential. How does it feel? What is your body saying to you when you are your emotion, your mind, when you need the alcohol? Is it something that sort of you really don't have control and you really need to have it, otherwise something is not comfortable. So if you can describe what it is, how does it feel, what are those thoughts and feelings, and how does physically you feel when you have alcohol, and how does it feel positive when you are trying to recover, in the sense of how was to be the next day at work, and so on. So is that something that follows you, the thought of I need to drink, I'm not feeling comfortable? Is that thought continuously all day with you? How was your experience with that? I just want to go a bit more in depth of really how a person experiencing alcohol use feels like.
Sure. Simple answer, yes. Every day when it used to start off during the later stages where I was totally dependent on alcohol, every day when it started off, I used to plan two things, or three things rather. One used to be my day involving work and logistics, dropping, picking up, driving, and all that. Second, what story do I cook up at home to
Mm-hmm.
ensure that I get my fix of alcohol before heading back home or whatever. So that part of the planning.
Mm-hmm.
And the third part was how do I accelerate this? Like how do I probably start an hour earlier in terms of consuming? So
Yeah.
so
Okay.
it used to become, it was sort of like a game, a puzzle which used to
Mm-hmm.
happen every day, right?
Mm-hmm.
So, and all this would happen, and probably sometime late afternoon, the
Mm-hmm.
pangs would start kicking in.
Mm-hmm.
In the sense, I'll start looking forward to leaving work, so that these were pre-COVID days, by the way. So there was actually a workplace and all that. So um, I would look forward to leaving work and getting to the closest place where I could get my fix.
Mm-hmm.
Um,
Mm-hmm.
So the things which happened around this, if things were getting delayed, I would be extremely irritated,
Mm-hmm.
angry.
Mm-hmm.
Uh, Physically, I don't know how to describe it. Probably sweating, probably hot flushes kind of thing used to happen. I don't recall that in as much
Mm-hmm.
vivid memory, but I do recall that the anger and irritation was a constant.
Was the highest. Yeah. Yeah.
Yeah. It was a constant in everything. It was a constant in dealing with anybody or anything at
Mm-hmm.
all, right? Any situation would be dealt with anger from my side. So that is the predominant
Mm-hmm.
emotion that I recall.
Yeah. Okay.
Um,
So, mm-hmm. Yes.
yeah. So like I said, that it became a game where I had to plan and get things done. And of course, it spiraled it spiraled when I say started taking more leaves,
Mm-hmm.
started taking getting more creative in terms of my stories of how to
Okay.
create situations to
Mm-hmm.
drink. Yeah, and safe to say, I pulled many friends along who were semi-casual kind of drinkers. They became a
Mm-hmm.
little more regular because of my pulling them along. So
Mm-hmm.
yeah, all of this is what I
All
would
of
say.
this. So you said that, thank you so much for sharing. So you said that you had three things to plan. First, your work and pick up and drop and routine, and then the drinking, when to start and how to. So how could this first plan, the involvement, obligation around family and other thing, could they still be in the plan when the alcohol was sort of biting more and more from your time and attention? Were you under the effect of alcohol, being able the next day morning to keep up and do your routine obligation as a family member or as a corporate employee? How much alcohol was impacting that?
I think it was impacting to a large extent towards the later few months because
Mhm.
I was consuming very heavily in those especially the last couple of months before I took the actual step to take help.
Mhm.
Before then, it was there. It was on and off. There used to be phases where it was very severe. Then I would come out of it for a while, things would be
Mm-hmm.
right and good, and the relapse would happen again. So it wasn't consistent or
Mm-hmm.
continuous earlier, but the
Mm-hmm.
last couple of months it was pretty bad because everybody knew that, everybody meaning anybody associated, right?
Around,
Family
yes,
and
around you,
workplace,
yes. Mm.
everybody around, friends as well, knew that I was doing this, and there was very clear impact
Mm.
uh, that was there. But before that, I would like to think it was managed, though, like I said, it was phases.
Mm,
There were
yeah.
very bad phases, and there were times when things were slightly better. But
Okay.
it was a part of my life for many, many years. So there's
Okay.
no taking away from that fact.
So, yeah, thanks for that. I'm sure many people understand and realize that they need to give up on that. But like you said, many people had told you that you have to stop, but that conviction from your side and that belief came much later when situation was worse or was very severe. What was running in your mind, if you can share with us, as like, what were those blocks that were saying you, okay, maybe later. Okay, I don't need that. I don't need help or whatever that delayed it so much.
I think it was the refusal to accept that I had a problem.
Mm-hmm.
That I think that was the main issue. Uh, Somewhere in the back of my mind, I knew I had a problem, but I think that acceptance and the ego to sort of say, yes, I have a problem and I need help,
Mm-hmm.
that lost to the other part of the conscious, which says, okay, I don't have a problem. This is something which I have control over, and I
Mm-hmm.
can start and stop as I want to,
Wish, yeah. Okay,
as I
thank you.
wish. I
Yeah.
think that was the main thing.
That's all. So, just a bit about, and thank you so much for sharing all these detailed information. How was the rehabilitation? How was the intervention? So, when you decided, you went for it. A bit about it, that process. I don't think it has been a simple journey for you to go through the addiction, uh, physically, mentally, emotionally, the process, and keeping up with that. So that's where the strength is the most important, the willpower, the help around. So what helped you? What drove you to go ahead and keep up with this?
Uh, the the journey of rehabilitation, I should say, was surprisingly simple and easy once I decided to take the step. My
Awesome.
counselor and the staff at the hospital were incredibly supportive.
Mm-hmm.
Uh, I think one thing which has to come from the patient has
Mm-hmm.
to be acceptance and full submission to the process. Like
Okay.
it's probably something as simple as following instructions
Mm-hmm.
and thinking deeply help. And
Mm-hmm.
one part of the process was also medication. Uh,
Yeah.
did not miss out on medication of even one dose, I would
Mm-hmm.
say, in many, many years, right? Not a single dose missed. It sort of became an obsession to ensure that
Mm-hmm.
uh, take the medication on time. And yeah, the thought that one slip is all you're away from to returning to a very dark place is a very powerful deterrent, right?
Mm-hmm.
And it is something which is there always at the back of your mind,
Mm-hmm.
which was like driven in through multiple sessions of counseling also.
Mm-hmm.
And also the fact that the realization that I will drag down many more people again into something which they don't deserve at all
I see.
is also a very strong driving force. So no amount of thanks would suffice to my counselor and associated staff. So forever grateful for that.
Thank you so much. My last question for you, John. Many people approach and tell to you, oh, don't use, what is this? Don't become an alcoholic. So we'll use a lot of terms, and not everybody, not all the terms and words and sentences said, though have a good intention behind it, sort of hit the right note when somebody is using substance. What were some or one, just one, not some, but one expression or one sentence that really was unhelpful when you were struggling with some with alcohol use, and one sentence that was really helpful. And with this, we'd like to sort of address that form of communication that people need. So something that, from your experience, what helped and what didn't help in communication.
I think one which totally did not help, which I heard from multiple people, was um, you're a smart guy. You know
Mm,
what you're doing is wrong, and you
nice.
can do it.
Mm,
Uh, so it was, yeah, all three right statements, probably all three very obvious statements, but it used to
mm,
be incredibly annoying to hear
mm.
that.
I see.
Uh, and one statement which helped and which actually pushed me to seek help
Mm-hmm.
uh, was only you can help yourself,
I see.
was something which really opened my eyes because yeah, I'm a headstrong person. I do not take advice or
Advices. Mhm.
yeah, easily. I have to be convinced myself. So that one line definitely opened my eyes.
Thank you so much for your sharing, John. And I will now go to Eva, your spouse. Eva, hello. And thank you so much for coming here and being here with us. I hope I'm audible to you.
Yes,
Can you?
Erinda, you are.
Yeah,
Thank you for inviting us over. It's our
thank
pleasure.
you. Yeah. So, as I said, gracefully you have come here, and I would like to respect your presence as a, um, I mean, as a great supporter to your partner in this very difficult journey. So, we heard from him what went through him and his realization or the impact of those choices. So, from your side, I'd like to hear from your side as a carer, as a spouse, as a family member that you have made your life together, and suddenly something is different. So as a spouse, so your journey with when it started, how was the conversation, how the conversation changed, how relationship got impacted, uh, what went in your minds in trying to provide some support. So just simply your experience. I'm sure many caregivers will be listening and relating to you.
Well, sure, Erinda. So, I started noticing the signs as early as maybe 6 months before our marriage, right? And in spite of that, it took us 8 years before we walked in through the doors of a rehabilitation center. And all through our lives, our early marriage days, while we saw a lot of things, it started with, as John said, he was being a little more argumentative. Uh, he was getting very annoyed at the little things,
Mhm.
which was not uh, he used to be. I have known him through his, years before, almost a decade before we got married, and I slowly saw the change in attitude happening, and
Mhm.
but I failed to attribute it to his addiction. I
Mhm.
at various levels we just thought it was a phase that he was going through. It was probably the stress of getting married or
Yeah.
the challenges of stepping into a new phase in life. But we
Mhm.
saw the signs throughout. There was
Mhm.
reckless driving, him getting into multiple accidents, thankfully escaping with minor
Wow.
bruise, uh,
Mhm.
him not being very much physically present but emotionally unavailable. There
Mm,
were days, there were many nights that he would just go missing. He would not turn up home, and his family and I, we were all left wondering if he was safe, if he was, if
mm,
something had gone wrong, if we had no idea, what was happening. And then when we did realize that it was addiction that was, coming up, we didn't have any idea on how to deal with it. Unfortunately, there is a lot of campaigns, a lot of awareness on how to deal with addiction, but not much material or support out there for caregivers as such, for the role that family plays, or, how spouse handles it, or what siblings do, or what children do. So we were, uh, you know, uh, I think we were hunting for answers, but we couldn't
ah,
find many. Every time we confronted John, he would just brush it under the carpet, saying he was absolutely in control. He knew what he was doing.
mm,
He could turn around and stop it at his own will. He knew what his limits were. We didn't believe it, but we didn't know how to approach him, or how to seek help or what to do. Confrontations were getting pretty aggressive with time. Uh, Many a times I was labeled as being, overly critical or the nagging wife.
mm,
Uh,
mm,
it was certainly an emotionally overwhelming experience, an emotionally, exhausting experience, because uh, there came a point when the marriage started to break down. Trust and honesty are the pillars of marriage, but there was very little that we could share or communicate with each other. He was being unavailable emotionally, he was being distant, and to see a loved one suffer in pain and to not being able to help them out
mm,
is can wreck your marriage apart. It can wreck you as a person. I ended up living with the blame, with the guilt of not being able to do anything, and sometimes even blaming myself as to being responsible for where he is.
wow.
So it certainly was, a nerve-wracking emotional roller coaster ride, I would say.
Yeah. I can't even imagine. I mean, as you speak, I just get goosebumps. But thank you so much for sharing it. So I'm sure you would have felt alone in this journey. Seeking help from people around you, how was that? Explaining your position, asking for help. How did that go? Because sometimes it's just normalized then, or it's like it's not my problem. So how was that for you?
Right. So it was a mixed bag of response. Uh, of course, there were people who had good intentions, who tried to offer empathy and support, but many a times, support and empathy often came with judgment. Uh, Particularly when you're living in an Indian society, you're not free from judgment in any forms, and uh, particularly when you're dealing with, or when you're going through some kind of an addiction-related trauma, the
Mm,
stigma is all the more. So there was a lot of judgment as to why your partner drinks. It
mhm,
was most of the times it was attributed to us having a bad marriage, or one of us being a bad spouse in the relationship. Uh,
mhm.
we had, so much of unsolicited advice on how extending a family could, or having a child could solve the problem of addiction.
Mm,
So there was a lot of, judgment that we received as a couple. Uh, but yeah, like I said, we also had a lot of support. There were some people, close friends, particularly people at work, which was
mm,
least unexpected. And they offered many a times a silent shoulder to cry on, at least for me. Or they were just there listening without judging, without, even though they could do little in terms of solving the issue, they were always there
yeah.
to provide a patient here. But I think, in terms of even reaching out to many therapists, before I reached out to TTK. Before that, my experience with a
Mm,
therapist also was not very fruitful, because many times I felt that everyone wanted to address the root cause. Everyone wanted to only focus on the addict, right?
yeah.
And somehow, my role, or the role of a spouse, was undermined. I
Yeah.
am aware that for many a sessions I was asked to wait outside. I was not even kept in the picture. No one followed up with me or communicated or even addressed my emotions, my hurt.
Mm,
So
mm,
I just felt left out to a huge extent in the whole uh, in the whole program or in the whole recovery aspect of it.
process. Yeah.
So there was very little room or very, little that I could do or that I could reach out to people or, ask for help. And most of all, it was always the stigma, how many people out there would understand what I'm going through or would probably not socially isolate me from social gatherings or events,
Mhm.
thinking that I could bring in all this drama and that was
Mhm.
unwanted at a certain event.
Mhm.
So it was a mixed bag, like I said. Uh, but I'm happy I went through it because it was an experience, and
Mhm.
maybe us speaking out can probably help someone out there who needs this, who needs to hear this, that don't lose hope. There's always someone out there who can help you out. You probably just need to reach out to the right person.
Absolutely, absolutely rightly said. And that's exactly why we need to amplify the voices of people with lived experience because as you saw the numbers and already know there are a million of people out there who lives with substance use disorder and carers who are in so much of hope to solve. It's like, is there a magic wand to solve this problem? Because, like you said, in dual feeling guilty, feeling hopeless to help someone that you love, feeling guilty as, am I worsening? Am I helping? So it's very it's not a comfortable space at all to be emotionally, mentally, physically, financially, all get mixed together, and the impact is quite high. Eva, what is something that you'd like to? I mean, you definitely reached out to the service. So, how much were you part of it?
Well, at TTK, it was certainly a transforming journey for me. Uh, and that is primarily because this is the first place where my trauma, my pain was acknowledged. So, somewhere the counselors, the therapist at TTK understood that we both needed healing. We both needed healing together, and we both needed to be healed individually as well. Uh, One of the first rehabilitation centers where I felt, that I was in a safe space, where there are people out there who were willing to give me time to help
Mm-hmm.
me recover from whatever I've been through.
Mm-hmm.
They were also helping me, find solutions to not find myself entangled in the same mess time and again. So it is here I understood how I could enable a road to recovery for my partner, but at the
Yes.
same time, not become entangled in emotional manipulation, that I would say, right? So it is here where I finally learned that, I can probably trust my partner again. I probably need to be with him in this journey of recovery. And at the
Uh-huh.
same time, I also need to understand that uh, my pain was no less, my trauma was no less. I had the opportunity to connect with other spouses, families, members of people
Ah.
who were dealing with similar problems. And that
Mhm.
was certainly an eye-opening journey for me because till then I always thought that I had the greatest burden on this planet to carry, that I was going through something that nobody can imagine. But when I connected with other members, other spouses, mothers, fathers, wives,
Yeah.
it was, my pain felt, nothing compared to what I've seen some of them go through. At the same time, I understood that, one of the first things that you said, that this is a mental health condition. I always thought that it was a case of having a stronger willpower. Uh,
Mm-hmm.
that my spouse was being arrogant, that if he wanted, he could always give it up. I didn't probably, have the perspective to understand that rehab centers give you not just it's never about the willpower. It's a mix of medication, it's a mix of
Exactly.
therapy, counseling, and all of them in the right proportion probably bring in the path to recovery. I didn't have that perspective till I walked in through the doors of TTK. So that was a transforming journey for me where, where I think they helped us bring peace into our relationship.
Mhm.
It was not only about the recovery journey, but it was also about enabling life back for us, putting us back on the right track, and
Mhm.
showing us that it is a journey, it's a process, it's not
It's
an
a
end
process.
goal. So we
Beautiful.
live knowing today that we might need access to these resources in the future. There's never a point where we can say we are completely cured, and you always have to be. My therapist always said, always be on your guard. Alcoholism or any addiction is a very cunning devil, and I'm
Yes,
just re-quoting her when she says that you always have to be on your guard. She always emphasized that if you win today's battle, celebrate that. That is more
yes,
than enough. Don't think too much
exactly.
into the future. So it's just one step at a time, one day at a time. That's all we are working on.
Exactly. Thank you so much, Eva. And exactly, we celebrate today yours and John's win in this fight and battle that you have done. So thank you so much for sharing your opinion and definitely taking from your point, as you said, reaching to TTK where life seemed different, where support really looked different and approachable, open, and kind. So I would invite Soumya who represents TTK Hospital. Um, are you here with me, Soumya? Soumya?
Yes, I'm here.
Okay,
Sorry,
awesome.
there was a small.
Thank you for being patient and listening. I'm sure you know the story, but I'm sure millions of people don't know the story, and that's the pride moment of yourself and TTK team to tell us more about what TTK does and what is the substance use disorder concern. So my understanding is that TTK is Chennai is one of the C center and our key the addiction center and the key public center for government as well is founded in 1980 by Dr. Shanti Ranganathan following her personal experience with alcoholism in the family, initially as a daycare center focused in addiction. Today, correct me if I'm wrong, you have 70 plus bed multidisciplinary hospital offering a comprehensive care for alcohol and drug addiction. So
That's
just tell us about what is the situation in our country proposed, in addition to the numbers that I gave, as what is there available for people, where to look for help, support, what type of support. Like Eva said, not and John said, not every therapy that was offered or they access to was helpful. So, what is the best way? What are the best services, and what is there for people to reach out?
Thank you so much for this, Erinda. I think it is really going to be a great platform for people to build an awareness amongst people about various aspects of mental health and substance abuse being one of the biggest challenges that we are combating. Right? The trend is increasing. More so, the age of initiation is coming down. Earlier, you could see the age of 18, 19, but it is very shocking to see kids as young as 11, sometimes even 9, coming in with the substance abuse, initiating without being even aware of what they're getting into, right? An experimental or a
Yeah.
playful use, unassumingly leading them into substance abuse and addiction. So TTK, like you said, was founded in 1980 by our founder, Dr. Shanti Ranganathan, one of the first de-addiction centers in India, in fact, Southeast Asia. Now,
Mm-hmm.
there are a lot of de-addiction centers. Of course, there are many that have mushroomed over the years without license. That is a worrying part. All right.
Mm-hmm.
But apart from that, the state and the central government have de-addiction centers. The state has about 25 district de-addiction centers that are attached to the government hospitals, apart from which the central government has also funded integrated rehabilitation centers. The government has really diversified, and they're doing their bit, but due to lack of awareness, people always end up going to quacks. They go to
Mm-hmm.
these mushrooming de-addiction centers that do not have a license, that
Okay.
follow inhumane practices. They're lured by very low fees, right? So people
Mm,
find it
yes, yes.
easier, and when just say you can just drop them off and go, and so the family that is already combating so many challenges, for them it makes it very easy to just go drop them off and then hear from them after 3 months.
Yes, in this
So that is
fast-pacing life, definitely everybody's feeling how can I reduce the cost? Already there is a cost
correct.
associated with that, and how do I make this happen? And I see a new person, but
Yes.
actually it's not true.
That's right. So that is one of the major challenges that the government is also facing. And we, as a state level coordinating agency for the Ministry of Social Justice, we are also coming across many of these unauthorized de-addiction centers.
I see. Now, for people to understand, what do you mean are not licensed? How do people get to know, or how do they check that the
See,
service
one
that
thing is
is
ones
sort
that
of
are
asking
started
is
by the
good or not?
government.
Okay,
One thing is go by what the government has started the state. These are all free treatments, right?
okay. Mhm.
Attached to government hospitals in all the districts. So that is a
Oh,
safe bet. And the
okay,
ones that are listed by the ministry,
okay,
right?
okay.
That is the most safest rather than going by hearsay, and it's just easy. So what happens is most of these centers expect you to bring the client into the
Mhm.
hospital, but these mushrooming centers promise to come and pick them up from doorstep.
I
Right?
see.
That is
Okay,
easier for them. They just give them a call and say, "Can you just come and pick them up?" And then
I
there are
see.
two, three guys who come and pick them up. But most often than not, they follow inhumane practices and
Practice it.
it's locked up in
I
a
just
lot
want
of
to take this step
fatalities.
by step. Soumya, just allow me. I want to take. So first is should be licensed by the state government. The first source or the first door to go is go to the government service hospital where there will be a de-addiction, at least one focal point from the government which can guide you. So this is one. Second, you said approved by the ministry, which is very difficult for especially lay people to understand whether you are approved or not by the ministry. And it's so difficult, even culturally, people don't question much. I mean, they are already concerned and overwhelmed with the trouble. So, just to make it more simple for people, what is a protocolized or evidence based service? What should they expect? Which will differentiate between evidence based service and the one that are the quack and that they are ready to take you to suck you in this.
Before I proceed to that, one thing that would
Yes.
be helpful is when they go to a psychiatrist in a government setting, right? They
Mm.
would be in a position to refer them out to any of the de-addiction centers. And sometimes, if they feel there's an affordability, they are also referred to other places or
Private
NGOs
one.
as well.
Mhm.
That is one thing that people can just follow blindly. Go to a psychiatrist in a reputed government hospital, so they that can never go
That should
wrong.
be the first step. So
Yes.
go through the psychiatrist who is an educated doctor and
Yes.
is set in a hospital or in a government recognized settings.
Yes.
Good. So now what should they expect when they come for the
So when
service?
we talk about evidence-based, we are looking at a multifaceted treatment. First, that starts with medical treatment to handle or detoxify, right? Handle their withdrawals, managing their withdrawals in a better way. Most of them will have other comorbid conditions like physical and mental comorbidities. So all that is managed, post which a therapeutic setting is very important,
Mhm.
involving counseling, re-educative sessions, group therapy, and and family therapy is equally important
Mhm.
in rehabilitation, because the patient and the family, both of them have to recover together.
Mhm. Mhm.
Family
Mhm.
also has to recover along, because this is a family disease that not
Okay.
only affects an individual but also the family and his environment.
Is impacted at the same time. So what I understand is that medication, as well, John mentioned it, medication is part of it. Therapy, individual therapy for the patient, but as well for the family, but as well group therapy is that I heard. So just here to bring, and I want this to become very clear, that we identified and we said here that substance use disorder is a mental health problem, it's a mental illness. Just bringing here, like you said, it coexists with other mental illness. What are some of the mental illness that are strongly associated or you find that most of the patient have, other than just substance use disorder?
See, with alcohol usage, prolonged usage, there's anxiety and depression that always coexist. All
Mhm.
right. With drugs, the other drugs, they can be it can lead to psychiatric issues. They can lead to psychotic breakdowns.
Mhm.
Sometimes, we do not know if a psychiatric issue has caused substance abuse or substance abuse is leading to
It's
a
leading to.
psychiatric illness. So that is always, where we have to keep looking at the symptoms, and it's very difficult to derive that. This is
Mhm.
prolonged substance abuse like cannabis and
Mhm.
the other kind of substances, prescription drugs and stimulants,
Mhm.
also among young adults.
I see. So depression, anxiety are some of the most common.
Most common.
Yeah, so which needs as well to be treated
Correct. So
because I
that's
think this should be important for the rehabilitation part and recovery to maintain.
that's
So
right. So
what
that's
what
why
goes
a
along with it?
holistic
Yeah.
treatment is very important, because we're also looking at physical comorbidities, the liver,
Mm,
right?
okay.
Where the liver takes a hit in alcohol usage, neurological issues, sometimes underlying cardiac issues can be there. So,
Mm-hmm.
yes, so there are comorbid conditions that they come with. So all
Okay.
that needs to be treated holistically. So when they come in for treatment, first they're assessed for fitness for de-addiction, fitness to
Mm-hmm.
go through a detox, and
Mm-hmm.
sometimes underlying issues come up like cardiac issues. So we get them to resolve that first and then move
Come
into
for the addiction.
rehab. Yes.
I'm so curious actually to bring and to have a conversation with a person who went through this non-evidence-based services because it's really, I mean, I'm in part of the profession, but it's really inhuman and people need to understand the huge gap and difference between an evidence-based service and non-evidence-based service. And not only that, but what a person goes through when they are in non-evidence-based
That's
approaches
a
and
horror
how-
story, Erinda.
yeah, that's another story which is
A
worth
horror
bringing
story, yeah.
because it's another life lost, another hope broken in this, which as we see the depth of this problem is quite large as we see. That's great to hear. So how large is TTK? Can you tell us who are the professions there?
Sorry?
So that people understand the power of it. How large is TTK? Is it like
It's
professions
70
who are
bedded,
there? Yeah.
70 bedded. We are about 50, a member of 50 to 55 of us. It's a multifaceted
Awesome.
team, comprising of doctors, psychiatrists, medical and psychiatric social workers, psychologists, and the other support staff that
Mm.
work with us. So
Good.
we need that team to kind of run the place.
Awesome. That's great. And thank you to all your team members for doing the job that they are doing and supporting people. Uh, for the rehabilitation, let's say John now is out this many years. So what goes after that? So how much they continue to be part of the or how much we need to take care during recovery and rehabilitation, how to maintain, how
So
not to relapse.
yes, so there is while they are here going through the treatment, the family is empowered on the
Mhm.
recovery journey of the patient. The patient is also empowered, but also to look at signs for relapse. Now, each one will have different triggers, right? Each
Mm.
individual. So the counselor is one counselor is allotted to a patient and his family, and the counselor takes them through the recovery while they're at the hospital, and there is a 5-year follow-up that is planned for
Wow.
the
Okay.
patient, and their follow-up visits are planned accordingly based on the trigger factors, based on the risk factors, based on life situations that each one
Mhm.
is going through. The counselor is very aware, and the follow-ups are planned. Initially, it will be very, with like quick follow-up visits, right?
Mhm.
Once 2 weeks, and then
Much
two
more shorter in time, like
shorter
much often.
yeah, intervals. And then once the patient has stabilized, then it's longer intervals. But
Yeah,
the counselors are constantly in touch with their clients.
that's awesome. Just a question out of curiosity, what is the rate of success in this? As in, like, do you have a measure or
Last study
how do
that
you celebrate that part that yes, we made it with how many
uh,
patients you see in a day and what could you put a number to?
yeah, we keep doing recovery status every year, once in probably 6 months. We keep doing it, and the average is about 54 to 56% of sobriety.
Awesome. That's great. That's how I just want that we all collectively send hope to people.
Yeah,
That number can be more when the stigma is reduced, when the
right.
support is given much more early, as Eva said. It's just we alcohol, and I mean especially alcohol is so normalized. Like John said, if there is
Yeah.
any reason to be upset, that was the door to go. If there was something to celebrate, that was the door to go. So, with much more awareness and much more readiness to approach to people early stages, provide support, I'm sure this 56 is going to get bigger. And with that, it would mean that much more family are more in peace and more in harmony. It's this is not a cost only to the individual. It's not a cost only to the family. It's a cost to the entire country.
Entire,
Uh,
yeah, society.
Productivity is not there. So we really need to battle this for sure. That's great. Any key message that you would like to leave with people that are hearing, that are listening? We have quite a lot of people in the room.
Break the stigma, right? That prevents an individual and his family from seeking help. While that we are normalizing drinking, we are normalizing substance abuse, saying at this age it's very common for a boy to experiment and try.
Mm,
It is very, but why are we stigmatizing treatment, seeking
mm,
help? Why is there so much stigma surrounding seeking help while we are normalizing the other thing? And also, we are also looking to empower educational institutions, industries to be that support system for people to
yes.
seek help. Very
Mm,
importantly, we start with teachers in being able to identify substance abuse among students and not shame them or belittle them or punish them for that, rather
mm,
than be that helping hand or the support to seek help. Similarly, in industries, we need line managers, we need the management to actually give them that support, send them, encourage them for treatment rather than sack them out
check
from
them
job.
out.
Yeah,
Yeah,
that's
I
what we're
get that.
seeing everywhere. So that is something that we are doing our bit to create that awareness in bringing down the stigma. And now
Injustice, yeah,
crime, yeah, crime's increasing
crime
with
is in true.
substance
Yes,
abuse. We're also looking
yes.
to keep that chain.
Around 67% of domestic crime is made under the effect of substance. That's
That's
what
right.
statistics says. And it's very, very sad because there is a partner, there are children, there is the next generation moving on, and definitely children seeing parents have the more tendency and likely to, in adulthood, to use it or to become aggressive. So there is a huge negative impact in that. That's why we need to address. But coming to your point of corporates, yeah, we do travel a lot in corporates. We do a lot of education with them, and when it comes to substance use disorder, is the topic that I do address, especially starting with that zero policy that it is there, especially manufacturing because it is mandatory, but as well in the desk jobs, zero tolerance towards substance. So somewhere we are trying along, like you said, bringing that awareness. Can this zero tolerance policy, which is more a disciplinary rule and it's rightly put there, not that it's not rightly, but be extended and bring a more empathy in that and considering, like I repeated earlier, considering that substance use disorder is a mental health problem. It's not just a choice made then and there and people want to destroy or to disturb their life. Awesome. So I'd like to, I think we have come to the end. It's almost 7 o'clock. I'd like to thank you so much from my heart, John. Is Was amazing to hear your story. Thank you for being honest with us and sharing it. Eva, thank you for coming here and sharing your experience as a carer. I'm absolutely confident many will be encouraged to go ahead and sort of break these taboos and reach out for support. Soumya, amazing. I'm sure people finally find some information because, like Eva said, it was so difficult to understand where to go, what to do, how to solve this problem. So it's very important that people realize that though with their own wish and will they would like to help their loved one, it cannot be done because it's a medical condition.
That's right.
cannot be done alone totally. It needs professional support, it needs professional intervention, and it needs the right approach, an evidence-based one, so that people really recover and sustain, avoiding relapses to that. So thank you so much for being here. I would like to thank you everyone who was with us here and joined a live session. Thank you for being with us. I hope this hour has been useful and informative. So see you again in another yet session that at Mental Health for State India, of course, for another topic that really worries, bothers us, and we really want to talk loud about it so that people get more empowered in addressing mental health concern at early stages and they are confident in recovering back to their lives. So thank you again and have a great night.